I'm happy to welcome once again Dr. Joe Congini. He is a sports medicine expert at Akron Children's Hospital. Good morning, Dr. Joe. How are you?
Hi, Gene. How you been?
I'm good. So, a couple of high-profile sports injuries to talk about this week, huh?
Yeah, I did. I wanted to touch on some of these. They're local stories, and one tells us, hey, baseball season is right around the corner tomorrow night, and we're very excited about another Guardian season, and we have a great team to look forward to. But unfortunately, one of the real important parts of the team is the pitching, and a very important part of the pitching is Tristan McKenzie, and we got the word that he had an injury to a muscle that we're hearing a lot more about, Gene, called the teres major. And the teres major is a strap muscle that's in the back part of the shoulder, and it is responsible when people are throwing to accelerate and to rotate the shoulder to allow people to spin the ball or twirl the ball or throw breaking pitches quite a bit. And they call it the latissimus muscle's little helper. The lat is the great big triangular muscle in the back, and the teres major is a smaller muscle that helps augment or help the latissimus muscle. And people usually get a real sharp pain, our patients and throwers, in the armpit when they have this muscle injury. And unfortunately, Tristan McKenzie, he throws very hard. When people watch him throw, he really does spin the ball quite a bit. But there's always a worry when you do that and you use a lot of your body that are you going to overload some of these muscles? And apparently the teres major has been strained. They did not say it's torn. These are tricky to diagnose even with an MRI. And so we're all really hoping that he's going to stay within that 8-week range they're talking about. He's going to miss some time. He's a really good pitcher, and it is going to hurt the pitching staff. But we will keep an eye on the teres major strain that Tristan McKenzie, they call him Sticks McKenzie, has, because we're excited about the Guardian season starting tomorrow night. So that's one injury I wanted to touch on. The other that has a lot of people scratching their head, Gene, is LeBron's injury, his foot injury. It's over a month now, and remember there was a lot of video of it when he went down. You could hear him audibly say on the tape that he felt something pop in his foot. And early on, they didn't say much about that. They just said he was rehabilitating in a timeline to get back. But he did admit this week that he had a tear of a tendon in the foot. I think it's a tear that we see in twisting foot injuries, not ankle injuries. And LeBron admitted also this week that he went to a couple of specialists, and two of the specialists told him he should have surgery now and be done with the season. But he said he went to a third specialist who he called the LeBron James of foot surgery and foot doctors, and he told him that it was healing pretty well and that he could get a chance to try to play with it. And knowing LeBron, the way he plays through a lot of different things, LeBron is trying to play through this. So he's already been back out on the court. He didn't put it past the possibility that at the end of the season he'd have that surgery, but right now he's going to try to play in the playoffs. But I did have to, it brought up a question in my mind, Gene, what if he was still a year away from passing that all-time scoring record that was so important to him and such a major milestone in his career? If he had that foot injury a year ago or 6 months ago and he still hadn't passed that record, I really wonder what decision he might have made.
Well, but he didn't have to make that decision, so that's good. I'm always concerned, though, when we hear about players playing through serious injuries like that, like, you know, so especially when it's a tendon. I mean, that's pretty serious, right?
Yeah, I especially what I think is going on. They're being very vague with it, but the kind of injury is very hard to come back from. But we know LeBron to be almost superhuman in our part of the country, and he's played through so many things in all of his years of playing, but he is getting later in his career. So I'm with you. I'm a little bit worried if he plays and makes it worse. Of course, I haven't examined him. Of course, you get different opinions. And the third part I wanted to just touch on is a lot of people come to me for second opinions. I don't think second opinions are a bad idea. And so that a lot of times people just want more information or education, and I think that's good. But I have a couple rules with second opinions. Number one, I'm never very critical of the doctor, particularly if it's a surgeon, the surgeon about what they might do, because I don't want my athletes to lose confidence or lose faith in that doctor if they decide to go with the doctor who gave them the initial opinion. So I'm never critical, but I will give them the names. I'm also a big one on giving at least two names instead of just one name of who I might recommend who does this type of surgery. And so I probably in a career have given hundreds and hundreds, Gene, of second opinions, especially because I'm not a surgeon. So people know that I don't have anything to gain. I want to try to help them the best I can. So when people are really not sure and they come to a little fork in the road medically about which direction they should go, I think second opinions are not a bad idea. In this case, LeBron seeked out a second opinion. He said it was a very well-known foot specialist. He didn't say who, but that opinion was to give him a shot to go back and try to play in the playoffs. So we will watch LeBron in the playoffs in the next month or so and see how he does and hope that he doesn't have to have that surgery ultimately. And we will watch Sticks McKenzie as he tries to rehabilitate that shoulder and get back in the months of probably late April or early May before McKenzie will even get out there and start trying to rehabilitate that thing. So we'll keep an eye on those injuries. They always play a role in how our sports teams do. And I just wanted to shed a little bit of light on those two injuries and second opinions.
That's great. Thank you so much, Dr. Joe Congini from Akron Children's Hospital.